the doctor from Louisiana. Would you like to jump in? I did throw this chart up here about cancer rates in different countries, and so if you want to talk about that.
Yeah, let me address that. I think that's a real good, we were talking a moment ago about the fact there's two ways to save money and create save money in healthcare. One is to have the patient become a savvy consumer and make choices for himself or herself in combination with his or her doctor.
That's called free enterprise, I guess.
Free enterprise, that's right. Free choice. The other way is to have a total government control, and then you're going to have long lines and rationing. Now, in the countries that have the latter, that is the long lines and rationing, and these are well-developed countries like Canada to our north, the United Kingdom, the difference in death rates from common cancers, breast cancer and prostate cancer, are unbelievable. We're getting extremely high cure rates, well now over 90%, and we're getting it here in the United States. And just let's take breast cancer. Breast cancer affects 1 in 6 women. And let me say parenthetically, the other side over there talks about women's rights and all the things we need to do for women, but yet if we follow this pathway, we're going to have a lot more women dying of things like breast cancer, because here's why. You look at the UK, the United Kingdom, they don't pay for mammograms. And also the better chemotherapeutic drugs that can cure the more difficult cases of breast cancer, they don't pay for them. Why? It costs too much. It doesn't fit into the budget. In Canada...
So when the government doesn't have enough money to pay, they just say, well, we're not going to cover certain things because they're too expensive.
Exactly.
So the government makes a decision as to whether or not you're going to get care or not, which is rationing.
Unelected bureaucrat.
And so you've got here in the UK, I don't know, these numbers here, this is women, but this isn't just breast cancer, but cancer in general for women. The survival rate at 52% or 53%, 66 in the U.S. So this difference is because of the fact they're just not covering some things.
And if you multiply that times the number of women who get cancer, you're talking hundreds of thousands of women just in that range.
So if you want to know why the telephone's been ringing off the hook, and there's a whole lot of people who don't like this bill, here's a whole block of people. Anybody who might get cancer, this is a pretty good reason not to like it. Is that correct, Doctor?
Well, that's absolutely right. And furthermore, just as a way of example, we actually had people from Canada and from the United Kingdom, both patients and doctors, who came to testify before us. And they told us really crazy things that we would never accept in the United States under our system. One is, if someone gets cancer, oftentimes they're told, we're going to watch it. We're going to watch cancer. That's crazy. Why would you watch cancer? You've got to treat it. But see, in their country, in Canada, in some places it's 2.5 years just to get an MRI scan. Then you get in the waiting line to actually get the surgery or treatment.
So if you're in Canada and you got cancer, what you really want to do is you don't want to sign up at the hospital. You want to sign up at the airport.
Absolutely.
For a flight that's going south to the United States so you can get taken care of.
Yes, absolutely. And just one last thing. The way they define emergency surgery in Canada is any surgery that doesn't, at this moment, save your life. And what does that mean? Someone who needs bypass surgery has a 99% lesion in their artery. Unless they're dying that moment, if they get bypass surgery, that's elective surgery. And we saw a recent example where a premier from Newfoundland literally came across the border to get his heart surgery because he chose the United States of America to get his care as opposed to his own homeland. And we know people come from around the world. If they have the resources to get care here, they know where the best care in the world is. We got problems, but these are solvable problems that we can use a scalpel to fix rather than taking a wrecking ball to the entire system and rebuilding it in a socialist view.
Right. Yeah, I think the The point was made once that if you've got a bad faucet in your kitchen, you don't remodel a whole kitchen, you fix a faucet. So, again, I'd like to turn to my friend from Ohio, Congressman Jordan, and just see if you wanted to make a comment about that or a different point.